Erin, I have a really unpopular dinner conversation question for you. I've got some friends and women in my community who have talked quite discreetly and understandably so about fecal incontinence. Obviously, it's horrifying. And, some of them are runners, they're all active. And so, you know, we're all used to hearing about, urinary incontinence, but fecal incontinence is sort of like next level for women. Is it common? What can you tell
Yeah.
me about it?
That's like the ultra taboo. Like incontinence already is so taboo. And then we get into fecal incontinence and nobody wants to talk about it. But the sad reality is it is pretty common. Some of the research I've looked at shows as high as like 1 in 7 women once we're getting into this stage of life. And what I always say to women is like, first of all, it's common and it's totally treatable. We can help you with this. You have to think about it like your pelvic floor muscles have a lot of responsibilities for control. And that control spans both sides. So, we're talking about bladder control as well as, fecal control or rectal control. So, yeah, the muscle it wraps around all of our openings, our pelvic floor. And when we need control, it should contract. And when we need to void, it should relax. There's a really strong neuromuscular connection with your brain, your bladder, your pelvic floor, your bowels. And so when that connection isn't quite what it used to be, or those muscles aren't as fit and strong as they used to be, and the surrounding tissues aren't performing, like they've lost estrogen, all of that. As soon as we start to lose that tone in the muscle, we can start to experience some of these challenges. And especially if we've had issues with birth. So a lot of times with fecal incontinence, it can be that there was issues many years ago when we had children, and we're now seeing the effects of that later.
Okay. Yeah. So, do you see this in women who have never had a pregnancy?
Yeah, I mean, I think it can be related to birth, but it can also come with, unfortunately, with age and with muscle tone change and muscle loss and disruption to that neuromuscular connection. That can happen with surgeries, that can happen with kind of anything invasive. So, unfortunately, it is a form of incontinence that just doesn't get talked about very much, but that a lot of women experience. The good news is, just like any muscle in our body, we can train it, improve the strength in that muscle and help it perform the way it should.
Okay. And now, if this happens, as we get into midlife and we know that we're losing estrogen, our juicy hormone, how come we don't all experience this? Like, how do some people get the short straw on this deal?
I mean, I'm not a physician, so I don't know if I have the answer on why not everybody does, but
Right.
it's just like menopause in general. Not everybody has the same experience going through that transition. And so there's also a hereditary component to a lot of pelvic health issues, especially
Oh,
pelvic organ prolapse. So sometimes it's genetics, sometimes it's, a lot of factors in our life, like lifestyle and behavior modifications that might need to be made. So, for example, if, I'm somebody who doesn't drink any alcohol and the woman beside me drinks a bottle of wine a day, we're probably going to have different experiences with bladder function because alcohol is such an irritant to the bladder. So we always like with every woman who comes to see us at UROSPOT, we do a very holistic overview. We want to look at everything in your life, even how much stress is going on in your life. So you could be a woman who's never had children, is doing okay with the menopause transition, but all of a sudden a lot of stress happens in your life. And so your nervous system is very upregulated. That too can cause a lot of these symptoms to show up when our nervous system is very regulated and our pelvic floor muscle is leaning into a protective state. Because women, we carry our stress in two areas, our shoulders and our pelvic floor.
ah,
Women don't know about the pelvic floor part.
no, not at all.
Yeah, yeah. So when we have a lot of stress in our life, it's called the medical term is central sensitization. So when our nervous system is really upregulated, I always say think of that pelvic floor muscle as like it's leaning into protection. It's like I'm on guard. Something's going on and I need to protect this person. And so when the muscle is in a state of high tone, that can cause it to not be able to relax for voiding, especially so we can have more of these symptoms, unfortunately.
One thing I think is really unfortunate is we are making great strides in educating women, but I hear a lot of women feel like they just have to suffer with incontinence. In fact, I would even go as far as to say it's almost been normalized that having urinary incontinence is normal and we
Mm.
just have to deal with it.
Mhm.
But as I've done my own research through the podcast, that is absolutely not the truth. Can you talk about that a little bit?
Oh my gosh, yeah. I mean, I think this is the one line I say 10 times a day is that just because something's common doesn't make it normal. And so for women, this goes all the way back to the gender gap in healthcare and how that was manifested due to the lack of research in women's healthcare. Women weren't even included in medical studies, clinical studies that decide how we're going to be treated as humans with medication, with treatments, with surgeries. We weren't even included until 1993. So required to be included. So you can imagine that gap in data has manifested into this gender gap, and it has conditioned women to believe that we're just supposed to live with a lot of these problems. And on top of that, I think what I get personally as a woman very insulted by is if you see any of the advertising for pads and adult diapers, I mean, they're trying to condition us to think, wow, these ones are sexy. They're black or they have purple flowers on it. Oh, I can't wait to wear that. Like as if it's just a normal part of being a woman, but we're not idiots. Like we know that's a diaper and we do not want to wear it.
I'm not wearing a diaper. Oh, really? There is like, to me, it's something a little more insidious going on. If we're not wearing diapers, that diaper making company is not making money. So
Yeah. Yeah, and
better have us.
sadly, if you go to a lot of the long-term care facilities or nursing homes or retirement homes, they have, like, financial relationships with some of these companies. It's in their best interest to keep women in these. There's a position paper by the Canadian Continence Society, which calls out that incontinence is one of the leading reasons women are even admitted to long-term care, which is,
Yes.
like, we should be up in arms about this. This is something that can be treated, that, yes, we've been conditioned to believe is normal, but it is not. It is common to experience it, but your body should never leak urine. If it does leak urine or stool, that's a sign that there's dysfunction in your pelvic floor and you deserve to seek treatment and you deserve to go somewhere where the person is going to listen to you and actually treat you and not dismiss you and say, "What did you expect? You had children. What did you expect? You're in menopause." It's like I expect that my body's going to function the way it's supposed to.
Yes, exactly. I think it's really unfortunate because like you said, those ads, like women talk so openly about the products that they're using. And all of the products to me are band-aids. They're not solutions. And I mean, I wasn't even told about pelvic floor physio by my doctor.
Yeah.
And so then there's the other issue with urinary incontinence. Like I used to humble brag that I had a very strong pelvic floor, a tight pelvic floor. That's what I heard. But then I was told it's actually called an overactive pelvic floor. And I think that the misconception is that, oh, well, I'm not going to have urinary incontinence because my floor is so tight. But that's
Mhm.
actually not true, is it?
Not true. Yes, you can absolutely see a lot of these symptoms when our pelvic floor is, you're calling it tight. I'm saying high tone when there's that upregulation in the nervous system. All of that can cause these symptoms, right? And, so I talked about the gender gap in healthcare. Then you go into the lack of education for our primary care doctors about pelvic health. 65% of primary care doctors in Canada say that they don't feel comfortable treating pelvic health. Like they have not received the level of education that they need. So this all just leads to this cycle. And then to your point, the pad market is saying these are great, but all
Mhm.
it's doing is helping you live with it.
Yes.
We want you to live without it, right?
Yeah.
Yeah.
Yeah. And I think that for women, it's just one more thing.
Yeah.
And there are things in midlife that, maybe we cannot turn the clock back on, but this is not one of them. And maybe in some rare cases, it is an issue, but I think, I've heard women say that their doctors tell them that pelvic floor physio is just a scam. Yeah, that's doing a huge disservice to your patient. But like, never mind the rest of the industry. We're in sort of a world in menopause now where it's different for women because our doctors are not trained in menopause. And so naturopaths are doing a lot of heavy lifting now. But, 10 years ago, most people wouldn't have thought to go to a naturopath for a medical related issue or whatever we deem it to be. So I think there is a big shift in how women are seeking treatment and where they're going and who
Yeah.
actually has the answers now. So I learned about UROSPOT. I used to live in Leslieville, and I remember when you guys were coming to town and all the women were talking about it. I still think that there is a stigma that prevents women from going in and booking an appointment. And I
Mm,
also think women are afraid of pelvic floor physio because they think it's going to hurt because nobody likes a pap smear.
yeah.
But after having pelvic floor physio myself, I'm like, it is not at all like that. It is painless and it is remarkable.
Yeah, and that is a real issue for a lot of women, which is why at Eurospot we do pelvic health differently. Your clothes never come off, nobody's ever touching you. If you think about women who've survived sexual abuse, there's religious reasons, all kinds of reasons why women, they've had traumatic deliveries, they just don't want to take their clothes off and have hands and instruments inside their body anymore. And so it does hold them back from seeking care. And the research is pretty clear on this that only 25% of women who are struggling with pelvic floor dysfunction actually choose to seek care, which means 75% are struggling in silence, right? And so that was a huge motivator for me. Like that's the number I want to change in my life. And what I found is that by giving women a different way to do this, where you can remain fully clothed, you can still get the same outcomes, but never have any hands or instruments inside your body, still receive pelvic health physiotherapy, but just in a different way. That just removes this barrier and allows women to kind of say, okay, I'm going to go explore this. But you're right. It is still, there's still this taboo. Like we have women who sometimes it takes them a year to actually come in because I think there's sometimes shame around this. And
Yeah.
that's what I'm hoping to make the taboo talkable. Say, look, we're all struggling with this. Like most
Yes.
women are going to experience this in their lifetime. And, if it's happening to a man, you can bet they're looking for help.
Oh,
Right?
yeah,
Yeah.
absolutely.
There's a big difference between the men who come to Eurospot and the women who come to Eurospot. Men come in and they're just like, "Fix this." And women are like, I'm generalizing, but I find it in general, women are very much like, "Do I deserve this?" If it was our dogs or our children or our
Yeah.
husband, we're gonna do whatever to help them, but for our own health and wellness, we get into this concept of like, "Well, maybe it's not so bad." And it really I find with pelvic floor dysfunction, it's a slow downward spiral because it just starts to rob you of your quality of life, but it happens in a gradual way where it just becomes more normal, right, to you?
Yeah.
Like, "Oh, I have to wear a panty liner now when I exercise. Oh, now I have to wear a panty liner every day. Oh, now I have to move it up to a poise number 2 pad." And it just gradually gets worse to the point that you don't realize, like we see this all the time. Once we have helped a woman get back to normal, she's like, "Oh my god, I didn't realize how much I was thinking about this and how much this consumed my thoughts until it was now gone."
This relief is so tremendous.
Mhm.
I have friends where we have to schedule like a morning hike or something around bathroom schedules because they're afraid that we're gonna get moving and things are gonna happen, and it's so unfair. Like, it's
Yeah.
such impact on your life. It's not a little thing.
Yeah.
One thing I think this is actually how I even discovered you in the first place. A couple of years ago, I tried the Emsella,
Mm.
and I didn't realize then I had an overactive pelvic floor. So I don't know if it like would have done the same for me, but I loved that again, you don't take your clothes off. It was really simple. But also, after that, I'm like, could I actually do a proper Kegel on my own? I don't know. But also I think the women who are afraid to come in or feel the shame or stigma are probably getting their information online. And there are some great resources, but then again, and this is a question for you because I don't know for sure, but I would imagine, depending on the strength or level of your floor, maybe Kegels might be overdoing it. Like
Mhm.
it's really important, I think, to understand what the actual issue is
Yeah.
before you just start Kegeling up all the time.
Yeah, no, it's great. It's a great question and comment. So incorporating technology into your pelvic health care is a really great thing to consider. That is a part of our care plan at Eurospot. And I always say that technology has a place in care, certain technology. What matters is where you seek care. Because to your point, if you just go and sit on a chair that's maybe like in a Botox clinic where they don't have any expertise in pelvic health, and you do have a very upregulated nervous system or your muscles are in a state of high tone, that could make things worse for you. For example, like Eurospot, where we're going to do a very comprehensive assessment with you. We're going to talk about all kinds of things. We're going to do certain measurements and metrics around how upregulated you are. and we're going to incorporate the care of a physiotherapist, and then we're going to individualize your care. If you were to use the technology in a state where you're a little more upregulated, there's a lot of things we're going to do to help you downregulate before we ever turn the equipment on. And we're going to very much adjust you may only come in once a week. You may only, get to a certain level of intensity. We're going to adjust things as needed so that we can balance the tone of your muscle. So where there are pockets of high tone, we're going to help that relax. And where there are pockets of weakness, we're going to help that strengthen. But the problem I have is that sometimes technologies like this, they're not even legitimate. They've been brought in illegally over the border from God knows where. There's some sort of counterfeit device that they've snuck by Health Canada. It's with a provider who doesn't know pelvic health. And that makes me very, very nervous for women. This is why the consultation will always be complimentary at UROSPOT, because I want women to come in and experience what really good pelvic health care looks like, and to leave a little more educated and empowered than they were when they arrived, so that they're in a position to make a decision for their health and wellness. Because to your point earlier, like women today, our generation, we're the wealthiest generation of women that has ever lived on this planet. And we are just not willing to accept really crappy healthcare anymore, right? And so we are going and seeking options, like you said, naturopath, whatever it is. We're saying, screw it, I'll go find an answer for myself. And so I love that women are starting to do that, and this movement has happened. My thing is just, do your homework, really do your homework about where you're seeking care.
Absolutely, because one thing is, like, going back to our earlier conversation about an overactive pelvic floor, or, I forget
Mhm.
what you called it. Well, I don't have incontinence, and I have this overactive floor, and it turns out, like, I actually had a pain in my back, and I had no idea it was related to that. My
Yeah.
doctor kept telling me it could have been from the epidural, which was nowhere near where the pain was.
Mhm.
So if I was someone who were going to skip the process and the consultation, I might go sit on the Emsella chair for 22 minutes and do some serious damage and think, but this is great. Like, I don't pee my pants, so I don't have a problem. But the reality is, I actually did have a problem.
Mm.
So this is like, to me, the same as like women now being able to buy hormone therapy by mail in the US. How dangerous is that? And this is dangerous too. So like women cannot skip the consultation. Like that's and they have to, do their research, go to someone like you who knows exactly what they're doing and gives them a proper assessment before giving them any sort of a treatment.
Yeah. It's something I'm legitimately concerned about with poor providers who shouldn't be doing this type of care, that I do secret shop it sometimes to just understand what is out there, because it does make me uncomfortable and worried for women. There was one the other day, they didn't ask a single question, put the woman on the technology and said, off you go. And there's major contraindications. We have to be checking, do you have a copper IUD? Do you have any metal in your body that could
Oh.
heat up? So this is why I'm saying, like, you have to go to a legitimate provider. If all you're going to do is look at price, be careful, because, you're going to get what you pay for, and your health is worth a lot more. So really do your homework, really understand how long they've been in business, who's doing the treatment. It should be healthcare providers. You should be working with a pelvic health physiotherapist, with nurses. For example, at UROSPOT, no one in the world has treated more people with this technology than we have. We have 23 locations across Canada. We are the experts in the world. The manufacturer comes to us for information because we know what this can do and not do, and how to properly help people and make sure you are a fit for the technology. So incorporating technology is one component. If
Mm.
you do want to use technology in your pelvic health care, wonderful. But guess what? It's one component. You need to have a place where you are receiving excellent education tailored to what you're experiencing. Because even what you just described for yourself, it's very different than what another woman is experiencing, right? So we're going to give you an education program that is very tailored to your symptoms. And then 3, that includes health coaching. So we talked about those lifestyle and behavior modifications. You talked about wanting to be able to do a Kegel properly on your own. We're going to teach you how to do that, right? All of that's holistic care versus just, hey, come sit on this device and we'll see you
Yeah.
in an hour. Like, that's not it. It's a portion, it's one component. It has to be incorporated with education and health coaching.
I think that's where self-care becomes an issue for women in this age group. It takes time, it
Mhm.
takes patience, and we want a magic pill. So that's why people gravitate the menopause supplement, the chair that will fix your entire pelvic floor. But you wouldn't go to like some, place on Queen Street and ask for a pap smear. So, I would want all the information as well.
Right. Totally.
I have this word is a mouthful for me, but I'm gonna try and say it. Genitourinary syndrome,
Mhm.
which is common in menopause, sounds clinical, but many of us are living with it and we don't even know it. So, can you explain a little bit what it is? I'm gonna shorten it GSM
DSM.
and what women should be looking for when it and care for it as well.
Yeah. So it is a mouthful, the genital urinary syndrome of menopause. And so I always say that hot flashes get all the spotlight
Yeah.
during menopause. But as we know, those of us going through the menopause transition, there's so many other symptoms that pop up as well. GSM is, think about it like an umbrella term for many symptoms that are happening in the genital urinary tract. So those would include, like we've talked about, incontinence, bladder frequency. So if you're going very often, every 30 minutes, every hour and a half, you are going pee. That's too much. That's bladder frequency, and that's another symptom of GSM. Urgency, so that overpowering urgency that comes out of nowhere, and you're like, I need to find a bathroom this second, or I'm going to have an accident on the way. Vaginal dryness is a really big one that is part of GSM that a lot of women will experience. As we are depleted of estrogen in those tissues, we start to experience this atrophy or dryness in those tissues, and that it's something that can be treated. Painful intercourse, pelvic organ prolapse. So there's this kind of umbrella of symptoms that can be occurring during the menopause transition. And actually, the research shows that once women are through the menopause transition and looking backwards, 84% will say, I experienced GSM.
Oh,
84%.
God.
But
That's a
it's
lot.
again, these are the symptoms we don't always go talk to the doctor about. We talk about hot flashes and I'm having trouble sleeping, but we're not talking about waking up at night to pee. We're not talking about all these other things that are going on. And, for sex, like sex shouldn't hurt. It shouldn't hurt. And so when you come to us to talk about these symptoms and the menopause transition, we're going to follow the treatment guidelines, which include pelvic health or pelvic floor muscle training, which is what we do at UROSPOT, as well as topicals. So you could be doing a hyaluronic acid vaginal moisturizer. So just like we're going to try and keep these tissues nice and plump on our face, we have to think about the tissues down below as well.
Yeah.
They need that same help to stay plump. I don't like the word juicy, but that's what you describe it. And the other one we'll talk about is the importance of vaginal estrogen. That is one where you will need a prescription for that. Actually, in the UK, it's over the counter. So it shows you how far we still have to go. It's that safe. It's that small, a tiny little dose, a tiny, tiny dose of estrogen.
Yeah.
But what that can do, so chronic UTIs, the number of women who've told me their mother-in-law or their mother or their aunt or their grandmother passed away from sepsis due to a chronic UTIs, that is preventable. Vaginal estrogen right now. I don't have any of these symptoms right now, but I'm taking vaginal estrogen because I know what it's going to prevent down the road. So that idea of early intervention is really important. And GSM is something that, I'm going to talk about as much as I can because so many women don't know the importance of treating it early and preventing.
Absolutely, and look at the problems that it can cause. In fact, when I first found out that I had a symptom of GSM, I was talking to my doctor and she told me an atrophied floor, and I had a pretty difficult labor. I was told I would need surgery.
Mm.
And so I didn't do anything about it for years because I couldn't afford surgery because it wasn't covered, like most things for women. But now I find out I don't need surgery. I need estrogen, right? Or pelvic floor physio. It wasn't surgery. I wonder how many other women are getting that advice about anything related to GSM.
There are many surgeons who actually would agree with me that you need to explore conservative care before you go the surgery route. You owe it to yourself to at least explore what is out there that is non-surgical that will help me get these outcomes before I put myself in a situation where you're going under the knife, where there's long recovery, where especially for prolapse surgery, it has a very high failure rate. Like within 5 years, you're doing it again. What's broken here and can we fix it? Like if the muscle is not as strong and fit as it used to be, and so it's having a hard time doing its job, let's focus on the function of the muscle before we go and put some mesh underneath it to just kind of lift it up, right? Like at least give
Right.
ourselves that chance to see if we can fix this with some conservative care options. And most women are on a surgical wait list for sometimes years in Canada anyway. During that time, you owe it to yourself to go and explore conservative care. We've had so many women who we've been able to prevent surgery for, who were scheduled for prolapse repair, and were able to now go without it because they fixed their pelvic floor muscle.
That's
Mhm.
incredible. What about, and I don't know if this is a case by case, and it probably is, but a woman who has prolapse and has a pessary, is this something that you can also help with? Or is this something that is a little more severe?
Yeah, we can direct that. And pessaries are another great option in the toolkit of how to improve pelvic health. So, for those who don't know, think about a pessary like a silicone ring that is flexible that you insert, and then it kind of opens and helps lift up or stent up that pelvic floor, help give it the support it needs, right? So some women will have pelvic organ prolapse and they need to wear a pessary. Instead of doing surgery, they've chosen to use a pessary. Some women who are, high impact sports, if you're going to do something where there's going to be so much pressure, downward pressure on your pelvic floor muscle, running, jumping, you may want to do something that gives your pelvic floor just that extra support and care, right? So that you are also preventing a prolapse from potentially happening or stabilizing one that is already there. So that pelvic floor is a muscle that just needs support. If you think about like, if you have an issue with a muscle and you're wearing a tensor or something to help give more support, think about that the same as your pelvic floor. It's a muscle and
Mhm.
sometimes it needs extra support as well. And pessaries are a great option. For some women, they're uncomfortable with the idea of inserting and removing something. And so it might not be the right option for you. For other women, it is, but it is one of many options. And again, we've helped women who were wearing pessaries 24/7 who can now go without because the pelvic floor is fit enough. The fitness capacity has returned and it can do its job.
Good. That's really good news. And I hope that anyone listening will come talk to you because it's like a lot of things we've already talked about. I think we're just taught to accept it or we're not given the proper information and resources, which leads me to my next question. As you've probably heard from many women that come in, and I've heard this from so many women in my community, a lot of women are still being dismissed or misdiagnosed when they bring these issues up, these GSM issues with their doctor. What can we reasonably expect from our current care? And also, how do we find practitioners who are going to take us seriously about this? Because I know, like I said, some women are still being dismissed about this topic.
I know we hear it every single day. We hear it every single day, be it menopause symptoms or pelvic health or the combination of the two. I think the worst one I've heard is a woman who had a pelvic organ prolapse. So that's where your pelvic organ, it can be multiple organs, but you've got your uterus, your bladder, your rectum. One of them or more of them is descending down into the vaginal vault. The pelvic floor isn't fit and strong anymore like it used to be. And think about it like it's sagging, and so the muscles or the organs it's supporting are coming down as well, and it can be graded stage 1, 2, 3, or 4. Stage 1 or 2, you notice a heaviness or a pressure inside your body, like it feels like something might fall out. Stage 3, there's a noticeable bulge, something's not where it should be. Stage 4, it becomes external to the body. Anyway, this woman who came to see us, she'd been to her doctor. She was early stage pelvic organ prolapse and wanting to take action and do something, and he said, "Come back when it's getting caught in your zipper."
Wow. Wow.
Infuriating, right?
Disgraceful. Yeah.
Disgraceful, infuriating, like, give me a
Mm.
break. If a man walked in with an organ falling out of his anus, like, it would be
Yeah. I'm sorry. My testicle. You want me to?
yeah,
Yeah. You'd never hear that.
right? So, it's that sort of stuff that I think women need to be confident to turn and run and stop accepting
Mhm.
poor care and stop being dismissed, and I know that's hard,
But
but
you can't get a doctor.
yeah, it's very difficult. I find nurse practitioners are my personal experience has been nurse practitioners are just way more willing to listen and give you the time. And I've had great experience with nurse practitioners, but there are a lot of options out there that you can go and explore. And, like at UROSPOT, we always say the consultation is going to remain complimentary because we want women to come in and just learn what their options are, feel educated, feel empowered, and then they can make a choice for themselves. And then treatment is partially covered by benefits. But there are also private options out there for menopause care as well. And they're not break the bank. But, unfortunately, that is an option that many women may feel they need to explore if they are continuing to be dismissed. But, I always say that you have to advocate for yourself pretty hard in those appointments. And, when you're sharing this and he's saying or she's saying, dismissing you, you have to ask those questions. Is what I'm telling you common or normal? I'm sharing this with you. Is it normal or is it common? Because if they say, what did you expect? Well, I expect that my body should function properly like it
Yeah.
should. I recognize it's common, but it's not doing what it should do, and I deserve care. So it's a frustrating reality out there for women, but I do feel like there's this movement, there's this awakening that's been happening where women are just demanding better care.
Yeah, absolutely. I am going to tour your facility close to me next week in Ancaster, and I'm excited.
Mm.
But I heard a lot about you through women in my community, and your model's a bit different. Your model's unique and new, as well as different than walking into pelvic floor physio or walking into healthcare practitioner. And I really like that you do such great care up front before you even go near treatment. How did you come up with this process and what makes it so unique?
I've worked in healthcare for 25 years now, and a big part of my time in healthcare was spent in innovation as well. And in women's health, that's where I felt most at home. And I was a woman struggling with these conditions. So I was getting to the point where I talk a lot about quality of life. And when I say quality of life, I want women to think about what brings you joy. What brings you joy on a day to day basis, emotionally, physically, any aspect of your life. Going for walks with your girlfriends. Like, if that brings you joy, you need to think about that as quality of life. And what are you starting to have to make adjustments on and rob yourself of? And so my quality of life was being robbed because of incontinence. I had all of these symptoms and I had them at a young age. And I just remember the day where I was sitting in my car, having left the tennis court in tears, thinking, I'm going to have to give this up. Like, this is the thing I love the most, and I'm going to have to give it up. And I just thought, there's got to be a better way. And so as I started doing more research and surrounding myself with experts, and luckily, like I said, I've worked in healthcare for so long. So talking to OBGYNs, urogynecologists, pelvic health physiotherapists, the best of the best, and looking at technology, I realized that there was technology out there designed for women, approved by Health Canada. I knew it wasn't the only answer, but I knew it was part of the answer. And I just couldn't stop thinking about what if there was a place where women could come and receive the best of technology, the best of pelvic health physiotherapy, the best of health coaching. And all we do is pelvic health, and we just do it better than anybody else, but make them feel safe, seen, heard, all the things that I didn't feel when I started looking for solutions for myself. I didn't want surgery that failed every
Mhm,
5 years. I didn't want medication with a terrible side effect profile. I didn't want hands and instruments in my body, and I didn't want to wear pads for the rest of my life.
mhm.
And always worrying about it, right? Always thinking about what if? What if this happens while I'm wearing this or doing that? And so I just couldn't stop thinking about that. And the more I thought about it, the more I thought, I've got to do this. I've got to build this. The other idea I had when we built the company and opened our first clinic 6 years ago, and we now have 23 across Canada, was what if I also built a platform where women could become entrepreneurs and have more women helping women? And so
Yeah.
each of our clinics in Canada is owned by a woman in her community who wanted to improve healthcare for women. Some have been clients who graduated from our system and then went on to bring this home to their communities. We have nurses who own clinics who've been burnt out in the healthcare system and wanted to do something totally different. You name it, but they're all women that are just so incredible and are now, owning their own businesses too.
Amazing. And I love that it's women helping women because, I mean, really, when it comes to pelvic floor, I want a female. And I think, you know what? I used to think, oh, that I'm being a little precious, but no, I'm not. I want a woman who understands it. I think a woman I've had pap smears by male doctor. I noticed when I went to my first female doctor, she put the speculum on my inner thigh to let me feel the temperature.
Yes,
I
mine.
was like, that was an act of kindness. What was
Yeah, yeah,
because she knows that we're bracing and
yeah,
tightening, and that makes it worse, right?
right.
But only a woman knows that about another woman's body. Anyway, I absolutely love that. I've heard a lot of women talk about UROSPOT now, and it's not just the service that you're offering, it's the philosophy behind it, but it's also your perspective, right? You bring a lot of perspective and experience to understand what women really want to take the leap. which is in 2 years, we're hopefully not gonna call it a leap when women actually put self-care into their control, but I think women need to get past the stigma and come in and start to look
Yeah.
after themselves. So I think that's great. I think, like, and you guys are so successful, like, you're the name for pelvic floor health now.
Mhm.
And
Thank you. Got me I'm gonna that's what makes me wanna cry, 'cause that was, like, the dream was to be we had a woman call the other day, and she said, "I wanna come to see you guys because you are the gold standard," and I just thought, "Wow," like, that feels
that's
so good because that's what we wanna be. That's exactly what we wanna be, and most of the women who work at UROSPOT, we are all women who've experienced this, right? Like, we can empathize, we totally get it. We've lived it, like, we absolutely get it.
yeah, you are a pelvic dream.
Being team, yes.
Just to wrap this up with you, Erin, oh, we always make jokes about peeing our pants, and, sometimes I think, are those jokes funny or are they bittersweet? And, like, we look at a trampoline with fear, and sneezing is a problem, and I'm hoping that, with everything that's happening in women's health now and with all the hard work you're doing, we're gonna stop making these jokes and having women and the media and society and healthcare practitioners take our pelvic health more seriously.
Mhm,
If you could tell women in midlife one thing you wish they knew when it comes to this part of their wellness, their pelvic floor,
mhm.
what would that be?
I would really encourage them to seek help. Just seek help because the thing I think women are shielded from knowing that I think is appalling is that this robs us of our independence.
It
It's
does.
anything. We'll either fall in a bathroom in the middle of the night on our 3rd trip to go pee when we're 80, break a hip, and then that's it, or we're gonna be admitted to a long-term care or retirement community because of incontinence, like
Incontinence, that's the sign, isn't it? Like,
yes, it is like it is an absolute measure of your pelvic health is a measure of your overall health. And so women, I think, knowledge is power. And so when they know that earlier, and I gotta tell you, this next generation of women, like because we treat women as, as young as 20 years old, and our oldest client is 99. And so I see it all. And the shame with the older generation about this and the difference with the next generation, the women having babies right now, they will call and be like, "Hey, just had a baby 5 weeks ago, like, there's no way I'm living like this, when can I commit?" Whereas, I would just thought I had to live like that for so long. So there's a movement, there's a change happening, but my message would be to women to be aware that this can rob you of your independence and really wreak havoc on your quality of life if you don't either prevent or get ahead of the curve or just treat. You can treat whenever. It is totally treatable. You do not have to live like this. That would be my number one message.
and, we started off with the dinner party conversation on fecal incontinence, the most
Mhm.
popular of the symptoms.
Yes.
I feel like that one is the hardest because I see friends suffer in silence with that one, and
Mhm.
they're even too embarrassed to probably come into you. So, could you say anything about that? Like, when you and I chatted at the menopause show, you mentioned that stat, 1 in 7. It's, like, women need to hear that. They need to,
Yeah,
like they do with everything in midlife, we're not alone.
totally.
We're not the only one.
And they need to know, like, again, when you come to Eurospot where it is a complimentary consultation, you're gonna immediately feel, "Okay, I'm with people who I don't have to be embarrassed to talk about this." This is all we talk about all day long. All day long. We
Yeah.
love it. This is what we talk about, and we want you to feel totally, like, safe and seen and heard. But when you come into a place where all we do is pelvic health, where it's extremely private, the discussion is in a living room, like you're on a couch and a chair and you're just, having a conversation with a woman who really cares and who's gonna make you realize that what you're experiencing is not normal, but it's very common and we can help, and that's you use I always see the shoulders just come down like, "Oh my god." Because a lot of women haven't even told their partners that they're struggling with this, like, it's been so bottled up. Women who don't leave their homes anymore for fear of what could happen outside, if they need to have that freedom and confidence returned, and that's what we can do for them. So, yeah, just seek help, seek help.
I just wanna leave you on a party note to say It's not just what you're doing for women's physical pelvic floor health that is so critical and makes you the gold standard. It's the fact that when you have women come in and they can have those conversations on a couch, what you're doing is making this a normal conversation for women to have. So when they leave, and we know that women get their information from other women, you are like a critical part of the movement that is normalizing the conversation, which is opening doors for women, which is building our confidence and giving us the support that we've
You-
always needed. So thank you and good luck with the UK launch.
Thank you. Yes, we're really excited. Really excited to help all the pelvic floors there too.
The British pelvic florist.
Yeah.
Thank you so much for your time, Erin, and all of this great information.
Well,
And I'll
thank you for what you're
for
doing too, because this is what we need. We need women just talking about women's health, talking about this and making this normal. So thank you.